Hello and welcome. My name is Dr. Tom Hagopian, Dr. Tom from Peachtree Plastic Surgery here in Atlanta, Georgia. And today I want to talk to you about the 5 things that you should know about plastic surgery. There's probably more than 5, but we're going to talk about 5 of them today, the most interesting ones. The first thing I want to talk about, plastic surgery is a personal choice and should be. So when you go in to see your doctor, you look in the mirror and you see something about yourself that you don't like, that's when you should see a plastic surgeon. People come to us sometimes, they'll come with their boyfriend or they'll come with their significant other, and the significant other does all the talking. They're not really engaging with us, but it's someone else. And those are usually red flags for us. Plastic surgery really, it's very individualized and it's a very personal choice. We are here to fix, not really fix, because a lot of plastic surgery, especially cosmetic surgery, is not about fixing, because most people come in are normal, and there's lots of variants of normal. It's not about fixing, it's more about enhancing. So we're here to enhance or improve upon a certain area of whatever is bothering the patient, and with the goal of making the patient feel more confident in their own skin. It's not so everybody else thinks they're pretty. That's really not what we do. If that's the motivation to get plastic surgery for somebody, that's the wrong idea. You're going to be very unsatisfied, because there'll always be people that don't like how you look for whatever reason, and you can't please everybody. You only please yourself, and that's what you can do. That's what the point of what we do is. It's a personal choice, but it's also very personalized. So when you come to me, I could have 5 different people come to me and say, I have this fat in my belly and I don't like it. I could give 2 of them, say, liposuctions for you. One of them needs a tummy tuck and the other one has a hernia and needs that fixed. It really depends on the individual person, and it depends on your age, what your goals are. That's kind of the biggest one. What do you want to look like? What's your goal body look like? And what are you willing to go through to get that goal body? Do you really hate scars and just don't want a tummy tuck scar at all? Well, that's going to change what I recommend to you. Are you totally okay with scars, but you just want the absolute best look you can get? Then we're going to change what we do. Also, how much downtime are you willing to spend? Can you take 2 weeks off of work? We can do a full mommy makeover. You'll look amazing. But that's not realistic for a lot of people. So it's very personal and it's very personalized. And that's the key to having a good result, doing it for the right reasons. That really is the most important. That's why it's number 1 on this list. All right, the second thing I want people to understand about plastic surgery, you should know about plastic surgery, is that complications happen. They're rare, sometimes more rare than others depending on the procedure, but there is always a chance, no matter how skilled your surgeon is, no matter how many times it's been done before, that you can have a complication. I see these Reddit posts all the time. I'm a frequent poster in the r/plastic surgery subreddit. You should come check it out. It's a good group of people. There's always a post every week or so about, is there always a chance of being botched, or I was botched, I'm going to complain to the medical board, or how do I get a refund for being botched? And some of these people that are botched, which I hate that term by the way, some of these people that are botched have a legitimate thing. Some of their stories, they go to a person who is not necessarily trained appropriately or is performing something that they shouldn't have done, or they went out of the country, and they have a legitimate claim of, well, they shouldn't have been botched because that should never have been done. But the majority of the time, people that are botched, it can just happen. So here's an example I like to give. Let's say I have 100 patients who are all young and really healthy, and they're 18 to 24 year old women, all with small breasts who want a simple breast augmentation. Most plastic surgeons with the appropriate training can perform 100 breast augmentations without making a technical error. In other words, without getting somewhere they shouldn't have, without causing too much bleeding, that kind of thing. If you do it 100 times, out of those 100 people, 3 to 8 of them will develop capsular contracture within 6 years. 5 to 14 of them will require another breast surgery by 1 year. 1 to 3 will get an infection, and there's a 10% chance that one of those 100 people will develop a blood clot. There's even a more remote chance that one of them will die. When we see complications like that, I would follow them along. We would stay with them, go through the journey with them together, address what we need to address, reoperate if we need to reoperate, treat the complications as best we can. But at the end of the day, 98 of those 100 people will be happy. 2 will consider themselves botched. If you look at rhinoplasty, the numbers for rhinoplasty are even much higher. And these are just because we're all human here. I'm human. I've made mistakes before in surgery that have caused people harm. And that's the nature of being a doctor and being a surgeon. We make mistakes. Bodies also don't heal the way we expect them to a lot of times. I'm human. and I'm operating on humans, which have human biology and human responses to injury that sometimes are unpredictable. And because of that, we can never be engineers in that way where if we did it perfectly, it would work every single time. All right, the next thing you should know, plastic surgery is a journey. What do I mean by that? So when you're going and you decided, you know what, I need a rhinoplasty. My nose is just a bumpy mess. Let's fix it. You're going to go online and you're going to find a plastic surgeon, and there's a whole way you're going to go about doing that. You're going to verify their credentials, and then you're going to go see them for consult. And you'll be in consult and you'll get a feeling for whether this guy or woman is a good person for you. Do they fit? Do you vibe with them? Are they okay? But the question you should be asking, is this somebody I want to go on this journey with? Think of plastic surgery or electing to go on a journey as getting on a boat and crossing the ocean. You choose who you want to get on that boat with, and then you set sail, you undergo surgery. Your recovery is like sailing across the open ocean. Most times, you've planned it out, you've looked at the weather before, you've got the right ship, you've got all the gear, and it's smooth sailing. You go through, you're out the other side, everything is good. But sometimes, there's rough seas, unexpected turbulence, a hurricane maybe, the Bermuda Triangle, some sharks, whatever. And then, when that happens, you want to know the person you're on that boat with isn't getting off and leaving you all stranded alone. It's a thing of trust, and you're really interviewing each other during a consult to see if this is the person you want to be with when things go wrong. Because there's always a chance they go wrong. And that's how you should think about picking a surgeon. Do they have the credentials? Do they have the experience? Do they have the before and after photos that you like? But also, if things go wrong, do I trust this person to be there for me on this journey? 4, let's talk about pricing. You can go on RealSelf and get an average price for a procedure, and you can call a bunch of different plastic surgeons. You'll find that procedure prices vary wildly among different surgeons. Some people will charge $7,500 for a rhinoplasty on the very low end, and some will charge $25,000. Well, how does that make sense? So there's a couple things in plastic surgery dictate our pricing structure. 1, it's market forces. We operate in a private market just like any other retail industry. Even though we're medical practices and we treat patients, not clients, we perform medical procedures and we care for people, we still do operate on a supply and demand curve. So if you're in an area like Los Angeles where the supply is very high and sometimes people would say outstrips demand, your prices, you can find people that charge less, that operate in that market. Also though, on the other end of that is the overhead to run a practice in Los Angeles is very, very high. And so your prices are going to be dictated by your overhead as well. You may need to charge more to stay afloat. It's not about profiteering or making tons of money, but it's about running a business. So that's a lot of it. Another thing that kind of goes into pricing is the experience of the surgeon. If your surgeon's been doing this for 50 years, or 30 years to be more realistic, because you don't want an 800-year-old surgeon. If your surgeon's been doing this for 30 years, probably going to charge more than a young surgeon out in practice. They can vary wildly. The most expensive person is not necessarily the best person. You can get a good result from somebody who doesn't charge quite as much, or you can get a worse result from somebody who doesn't charge quite as much. But what I'm saying is, don't be fooled that just because they're really expensive, they're really good, or if they're really cheap, they're really bad. But also realize that there's probably a reason they're cheap. And kind of think about it. The last thing I want to say, and everybody should know, is that not all surgeons are created equal. We have different training, and there's a lot of different people that call themselves plastic surgeons. So basically, there are 3 ways to become a plastic surgeon. The first way, which is the more traditional way, is to go through, you complete medical school after 4 years, and then you go on to a plastic surgery residency, which is either 6 years, or you do a general surgery or other surgical residency for 5 years, followed by 3 years of plastic surgery fellowship. Those people can then sit for board certification by the American Board of Plastic Surgery. These are your plastic surgeons that do everything from top to bottom, head to toe, reconstruction and cosmetic, fully trained. I went through a 6-year plastic surgery residency, and I am currently board eligible, which means I'm working towards getting my board certification by the American Board of Plastic Surgery. And this is what junior surgeons do when they go out into the world. The other surgeons, and you might have seen them, facial plastic surgeons they are. Those surgeons have gone through medical school for 4 years and then come out and do an otolaryngology or an ENT residency for 5 years. So they learn ENT, ear, nose, and throat surgery. They then will complete a 1-year fellowship in facial plastic surgery. It's much more focused than what we go through, but they are more than qualified to operate on reconstruction and cosmetic surgery of the head and neck. They are good surgeons. And then the final people that are plastic surgeons are oculoplastic surgeons. And they go through 4 years of medical school, 1-year internship, 3 years of ophthalmology residency, and then a 2-year fellowship, oculoplastic and reconstructive surgery. What this is They are more than eminently qualified to operate around the eyelids in the periorbita, on the forehead, and in the midface. So basically from here to here. They are qualified and trained to perform procedures in this area, and they are most times very good at it. Those are kind of the three people that we would consider well trained in plastic surgery. There's a lot of other ways to call yourself a plastic surgeon. There's no legal definition for plastic surgery. Anybody can call themselves a plastic surgeon. So you have to kind of be careful. You look for board certification, but then, of course, they invent all these other boards, like the American Board of Cosmetic Surgery, which is not ABMS, American Board of Medical Specialties recognized board. And in the state of California, they're not legally allowed to call themselves board certified in that, because their residency training is not as rigorous as the aforementioned three others. So when you're looking for a plastic surgeon, just know that anybody can call themselves one, but it's their training that matters. And it gets a little confusing nowadays. There's a lot of stuff going on out there, especially on the internet. When you hear and read things, reviews are not always great metric, but hopefully this was entertaining and joyful. You now know the 5 things you should know before you see a plastic surgeon. If you enjoyed this, please like and hit the subscribe button. You can find me on Reddit. I'm Dr. Tom PS. You can find me on Instagram at Dr. Thomas Hagopian, and I will see you next week.